Hi, my name is Courtlyn, and I'm going to be showing you how to reconstitute a medication and then administer it IV via Piggyback. My patient today is Charity Price. She's a 73-year-old woman who was admitted a couple days ago with pneumonia. She's been receiving Cloxacillin for this and has been tolerating the antibiotic very well. I'm just gonna grab my vial. I obtained this from my Pyxis earlier, and it wasn't discolored and it wasn't expired, so it's okay to use. I checked my doctor's order with my MAR, so I'm just going to do my first check with my Cloxacillin. So it's for Charity Price. She has no known drug allergies. She is receiving Cloxacillin. She's getting 1 gram, and this is a 2-gram vial that I'm going to be reconstituting. She's going to be getting this IV, and she's getting this every 6 hours. And I checked the time frame, and it was last given 6 hours ago, so it's okay to get. And now I'm just going to check it with my monograph. So it's Cloxacillin, an antibiotic. It can be administered by a student nurse, so I'm okay to give it. The usual dose is 1 to 2 grams IV every 4 to 6 hours. Maximum single dose is 3 grams, and maximum daily dose is 12 grams. Charity is getting 1 gram, and all of those are within the safe range. It is supplied as a 2-gram vial, so I'm going to add 6.8 milliliters of sterile water for this, for a final volume of 8 milliliters and a final concentration of 250 milligrams a milliliter. Because Charity is only getting 1 gram, I'm only going to have to pull up 4 milliliters of this medication for her dose. I'm going to be giving this IV intermittent. It's a 1 gram dose, so I can dilute it in 50 to 100 milliliters of D5W, normal saline, or dextrose saline solutions, and infuse over 30 to 60 minutes. I chose 100 milliliters of normal saline because Charity was looking a little dehydrated earlier, and she has no nutritional requirement for dextrose. What I'm going to do first, grab my sterile water, and I'm going to swab for 30 and let dry for 15 with an alcohol swab. I'm going to get my syringe ready. Because I need to drop 6.8 milliliters of this, I want to get that in air in my syringe. Insert my air into my vial. Then fill up my air. Recap. And I'm just going to pull back a little because I have a couple bubbles. I'm going to tap them out. And then I'm going to push up to my 6.8. And I see the drop, so it's okay. And now what I'm going to do is I'm going to take another alcohol swab, and I'm going to swab my Cloxacillin vial. Once again, swab for 30 and let dry for 15. And I'm going to insert my sterile water into my Cloxacillin. And then I want to relieve some of the air pressure with my syringe. I recap my needle. And then I'm just going to get rid of the air pressure for now. I'm going to slowly mix my vial, not too fast to avoid clumping. And then I just want to check and make sure it's all dissolved, which it is. And as I said before, Charity is only getting 1 gram out of this, so I only need to pull up 4 milliliters. So I'm going to take that back in air in my syringe. And I'm just going to re-swab my Cloxacillin vial one more time, just in case I touched it, so it's extra sterile. Swab for 30, let dry for 15, and I'm going to put my air into my vial. Draw back 4 milliliters of my medication. Got my vial. And I'm going to pull back once again just to get rid of some of the bubbles. And then just push up. And I see my first drop, so I'm okay. So now what I want to do before I proceed is I'm going to do my second check. So I have my patient Charity Price, who has no known drug allergies. She's receiving Cloxacillin, and I have my vial of Cloxacillin right here. She's receiving 1 gram, which worked out to 4 milliliters, and I'm just gonna check my syringe, and it says 4 milliliters right there. She's gonna be getting this IV in every 6 hours, which is in the right time frame. I'm gonna grab my mini bag, which is 100 milliliters of normal saline. Before I grabbed my mini bag, I just wanted to make sure it wasn't expired, which it wasn't, so it's okay to use. And I'm gonna swab the port here. Swab for 30, let dry for 15, making sure to keep the end sterile. Gonna uncap my needle. And then I'm going to put my medication into my mini bag, infusing it slowly. Withdraw my syringe, and cap this. Now I can discard my syringe because I don't need it anymore. And I'm gonna slowly mix my mini bag. Once it's all mixed, I'm just gonna take my medication label, put it on my mini bag, and now I can head into my patient's room, sorry. Before I come in, hand hygiene. Before I proceed, I'm just going to do a quick safety check. There's nothing on the floor, the bed rails are up, and my patient looks in no distress. So I'm going to grab my wine. Hi Charity, my name's Courtlyn and I'm your student nurse. I'm just here to give you your Cloxacillin. It's for your pneumonia. You've been receiving this the past few days and have seem to be tolerating it pretty well. But along with Cloxacillin, I just want to let you know that you may experience some nausea or vomiting. Is it okay if I give you this medication? Okay. Now I'm just gonna check her armband. She has no known allergies. And then Charity, can you tell me your name? Charity Price. And your date of birth? And that would make you 73? Okay. While I'm here, I also just want to take note of the IV site. There's no redness, no inflammation, and she doesn't appear to be in any pain. Charity, are you in any pain? No? Okay, so it's okay to use. And before I do this as well, I want to do my third check. So I have Charity Price, my patient. She has no known allergies. She's receiving Cloxacillin in 1 gram, which I added 4 milliliters to my mini bag. She'll be receiving this IV and is getting this every 6 hours in the correct time frame. Grab the tubing. The first thing I'm going to do is I'm going to lower my primary bag of normal saline. Normal saline is compatible with my medication, so it's okay to use. Now I want to get my tubing ready. Careful to maintain sterility. So the first thing I'm going to do is that I'm going to take out the end. Get rid of my spike. I'm going to insert this spike into my mini bag, making sure my tubing is clamped, which it is. Down. And then I'm going to grab another alcohol swab. Oops, sorry. And then I'm going to swab the port that's just above the pump. I don't want to use the one that's right by her wrist just in case she needs an IV push medication at some time. Again, I swab for 30 and I let dry for 15. Let's remove my cap. Now I'm going to insert my line into the port. Just going to re-swab that just to make sure it's sterile. Swab for 30, let dry for 15. There, now it's
I really don't like having.
So what I'm going to do now is I want to back prime my mini bag. So I'm going to lower it below my primary, undo my clamp, and then fill my drip chamber till it's about halfway full. There, halfway now. Clamp my line again quickly. Charity's mini bag was 100 milliliters and I added 4 milliliters of medication to it. So it has a total volume of 104 milliliters. And on my monograph it said I can run it between 30 and 60 minutes, so I chose 60. So I'm going to set the rate in my pump as 104 milliliters an hour. I'm going to confirm my secondary, making sure that my clamp is undone. I'm going to press start. Oh, it wants me to confirm my primary, so I'm confirming my primary as well. And then secondary is going. It says it's running on my machine, so I'm just going to wait for the first couple drops just to make sure it's running. Okay, I see the first couple drops, so I know it's infusing. Okay, Charity, your medication is infusing. Once again, you may experience some nausea or vomiting with this medication. Your call bell's in reach, so you can push it if you need anything. I will be back in a couple minutes to check on you. As well as monitoring for any side effects, I'm also going to monitor for if she's like not side effects, but so that she's getting better, sign she's getting better. So is she in less pain, and is it easier for her to breathe? So now I'm going to go and grab my tape for my line, and on it I have my initials, the date, and the time it was done. Okay. And now I'm going to go and document everything.